Are you trying to grow your family with endometriosis and you're wondering what labs might actually move the needle for your fertility? You're in the right place. In today's video, I'm sharing the top 5 fertility lab tests every woman with endometriosis should consider, including why they matter, what they tell us, and exactly when to get them tested. Please give this video a like, share it with a friend, and hit that subscribe button if you haven't already. So first up is progesterone. This is your pro-implantation, pro-pregnancy, anti-inflammatory, and anti-growth promoting hormone. It's essential for supporting the uterine lining and calming inflammation, and many women with endometriosis don't make enough of it. Why does this matter? Not only can low progesterone cause unpleasant symptoms like spotting, anxiety, issues falling or staying asleep, skin sensitivity, and heavy bleeding, but it can also lead to short luteal phase lengths, poor implantation, or even early pregnancy loss in some cases. I like to see 7-day post-ovulation progesterone over 18.5 nanograms per mil or over 58 nanomoles per liter. If your levels aren't quite hitting these numbers, here are a few things to consider. Diet-wise, are you eating enough? Undereating is a huge stressor on the body, which will force your body to shuttle resources towards cortisol production at the expense of progesterone. It's also important to include B6 rich sources in the diet, as B6 is an important precursor to making progesterone. Some great B6 sources to include regularly in your diet include chickpeas, beef liver, yellowfin tuna, sockeye salmon, chicken breast, boiled potatoes, and bananas. Vitamin D also supports progesterone receptor sensitivity, so getting enough each day is also an important consideration. Some great sources of vitamin D to include in the diet include fatty fish like tuna, salmon, mackerel, sardines, and anchovies, eggs, and sun exposure, which is not an aspect of a diet, but still getting exposure to the sunlight is a great way to increase vitamin D levels in the body. You can also consider supplementing between 1,000 and 5,000 international units daily, but this really should be based on your needs, which preferably should be tested in the blood. I like to see vitamin D in the blood over 50 nanograms per milliliter or over 125 nanomoles per liter. Vitamin D has also been shown to improve progesterone levels at supplemental doses of 750 milligrams per day. Some good food sources include kiwi, bell peppers, strawberries, citrus fruit, broccoli, and Brussels sprouts. My favorite whole food vitamin C supplement is the Paleo Valley C, which I'll link for you in the show notes below. Lifestyle-wise, stress management is huge for supporting healthy progesterone levels. Doing a handful of deep belly breaths every day isn't a hugely demanding task. However, it has been shown to turn off over 40 pro-inflammatory genes and activate the parasympathetic nervous system instantly. The parasympathetic nervous system is the rest and digest branch of your nervous system that communicates the right signals to your body about stress and survival. You also want to remain active, but not underactive and not too overactive. Overexercise in the context of low progesterone can overwhelm the HPA axis, the communication between the brain and the adrenals, suppressing ovulation. If you're unsure what's too much or not enough, stay consistent with some mild to moderate intensity walking, 30 to 60 minutes daily, or as often as you can manage. Another thing to consider is blood sugar stability. Abnormal blood sugar dips and spikes or insulin resistance is associated with anovulation. If you're not ovulating, you're not producing progesterone. My top tips here are space your meals 3.5 to 4 hours apart and always pair protein, fat, and fiber with meals. Some helpful blood sugar supporting supplements include things like chromium, ovasitol, and magnesium. Some other important considerations, which I won't deep dive in today's video, include maintaining a healthy weight, good sleep quality, and adequate cholesterol levels. Your sex hormones ultimately stem from cholesterol, so if you aren't making enough, you won't be able to make healthy hormones. So what about some herbal support considerations? In addition to the supplement supports I mentioned above, Vitex, or otherwise known as chasteberry tree, is a helpful herb to consider for progesterone support. Studies show 3 months of consistent use helped regulate irregular cycles, reduce pain with menstruation, and reduce breast pain. Additionally, Vitex can help with lowering high prolactin, which is also common in endometriosis patients and can affect fertility. Okay, when thinking about when to test progesterone levels, we want to test progesterone 7 days roughly after ovulation. If you have a short cycle or a luteal phase length under 10 days, you might also consider testing roughly 5 to 6 days after ovulation. Okay, the next lab to consider is AMH, which stands for anti-Müllerian hormone. This test gives us a snapshot of your ovarian reserve. While it doesn't predict your ability to get pregnant, it helps us understand how endometriosis and inflammation may be affecting your ovarian function and egg reserve. When I see a low AMH in an endometriosis patient, I do not immediately jump to recommending ART. In fact, ART, like IVF, is less likely to be successful with an AMH under 1 nanogram per mil. Instead, I turn my focus to boosting egg quality. Women with endometriomas who have had ovarian surgery often have reduced AMH, so this is an important consideration. Studies do show though that AMH often does bounce back to pre-surgical levels within 12 months. So if this is you, don't lose hope. I like to see AMH between 1.1 at the very least to 4 nanograms per mil, or between 7.87 and 28.5 pmol per liter. If your AMH is falling below these ranges, here are a few next step considerations. The first, test your DHEA sulfate levels. DHEA is a super powerful hormone that you can actually supplement if your levels are low. That has a profound effect on egg quality, but please do supplement based on these numbers, because if the levels are too high, it could actually have quite the opposite effect. Tip number 2 is to load up on anti-inflammatories. Some of my favorite diet-specific tips here include daily green tea or matcha, 3 or more colorful plants with every meal, lean more into lean animal proteins like turkey, chicken, fish, or plant proteins like legumes, tofu, or edamame if they're well tolerated. Prioritize high moisture, low heat cooking methods when preparing animal proteins specifically. And here I'm referring to cooking methods like poaching, slow cooking, or using a pressure cooker. Integrate fresh herbs and spices often, and integrate other anti-inflammatory bitter teas like ginger or turmeric tea. Anti-inflammatory egg quality supporting supplements to consider include 400 milligrams of CoQ10, preferably in the ubiquinol form, vitamin C combined with vitamin E in proportions of 1,000 milligrams to 800 international units daily. That's 1,000 milligrams of vitamin C and 800 international units of vitamin E. Omega-3s, vitamin D, NAC, zinc, melatonin, and some vaginal probiotic strains. I did a full-length video on egg quality supporting supplements, which I'll link for you in the show notes below if you want to learn a little bit more about what supplements to consider. Now, when it comes to when to test, any time in your cycle is okay to test AMH. It's not cycle dependent. Values vary by age, but anything below 1.1 nanograms per mil is considered low. Okay, third on our list is a hormone trio, including FSH, follicle stimulating hormone, LH, luteinizing hormone, and estradiol. These are critical on cycle day 2 or 3 to assess how your brain and ovaries are communicating. FSH that is too high can suggest diminished ovarian reserve, primary ovarian insufficiency, or even potentially menopause. Low cycle day 2 or 3 estradiol can indicate perimenopause or suboptimal levels for ovulation, while a high cycle day 3 estradiol can indicate low ovarian reserve, primary ovarian insufficiency, or PCOS. LH can help rule out other hormone conditions like PCOS, which can sometimes overlap with endo. A high LH can also indicate primary ovarian insufficiency, autoimmune disorders, or thyroid adrenal issues. When considering when to test, cycle day 2 or 3 during your early follicular phase. Ideal FSH levels should be between 7 and 7.9 MIU per liter. Estradiol should be around 25 to 70 PG per mil, or between 92 and 257 pmol per liter, and LH should be under 7 milli-IU per liter. If abnormal levels are due to age, there isn't a lot within your control to improve here. Some studies show that dietary phytoestrogens can help normalize FSH and LH levels. Myo-inositol and Vitex may also play a role in improving FSH and LH levels if this is a concern that applies to you. Okay, next up is Thyroid Panel. This includes a TSH, free T3, free T4, and preferably your thyroid antibodies. Sometimes thyroid panels can also include reverse T3 or a T3 uptake number. Why Why do we want to test this? Because the thyroid dysfunction is linked with both endometriosis and fertility challenges. Even subclinical hypothyroidism can reduce egg quality and increase miscarriage risk, unfortunately. The granulosa cells support egg maturation during follicle development, which obviously plays a big role in ovulation. These cells heavily rely on adequate free T3 thyroid hormone, another example of how ovulation, ovulatory disorders, and fertility relate to thyroid function and having adequate thyroid hormone. If you experience unexplained fatigue, weight gain, cold intolerance, low basal body temperatures, slow heart rate, dry skin, hair, nails, thinning hair, constipation, slow digestion, brain fog, poor memory, low mood, irritability, irregular periods, low libido, hoarseness, swelling in the neck, slow reflexes, losing hair in the third outer part of your eyebrow, or even infertility, it is essential that you test your thyroid function. Now, when considering when to test, anytime in your cycle, but caution with supplementation of iodine, selenium, iron, biotin, and zinc before your blood work. Stop biotin supplementation 2 to 3 days prior to having your blood drawn, and supplement the rest of these nutrients after your thyroid blood draw. We want to see TSH, thyroid stimulating hormone, between 0.5 and 2 milli-IU per liter, or between 1.5 and 3 UG per DL if you're trying to conceive. Free T3 should be between 3 and 4 PG per mil, or between 4.6 and 6.1 pmol per liter. Free T4 should be between 1.1 and 1.8 nanograms per deciliter, or 16.9 and 27.6 pmol per liter. And the thyroid antibodies preferably should be as close to 0 as possible. Here's a glimpse of some things I work on with clients to support optimal thyroid function. From the lifestyle perspective, research shows 10 minutes of red light therapy application over the thyroid 3 times a week can normalize T3 to T4 ratios and reduce thyroid antibodies. Sweating or supporting the liver via lymphatic drainage or liver-specific supplements is another way to support the thyroid, as the liver is the major site of thyroid hormone conversion. A burdened liver is not your friend when it comes to optimizing the thyroid. You also want to make sure that you're getting an adequate amount of various vitamins and minerals, specifically iron, selenium, zinc, iodine, magnesium, B vitamins, retinol, which is active vitamin A, and amino acids. These are essential for optimal thyroid function. The gut is your second most important site of thyroid hormone conversion. I talk a lot about GI symptoms and what they could mean in other videos. It's a massive topic though to cover in a single YouTube video, but I do have an extremely comprehensive low-cost course all about digestive symptoms and how to resolve them if you have significant concerns in this area. I'll link to that in the show notes below. You'll also want to keep your blood sugars as stable as possible, as blood sugar spikes or high insulin can lead to thyroid autoimmunity. Speaking of thyroid autoimmunity, vitamin D, selenium, and ovasitol supplementation have produced profound positive results in my endometriosis patients with thyroid autoimmunity. Eating gluten-free is another strategy that often helps, but it doesn't help everybody equally. Vitamin D supplementation should be based on need, but 100 to 150 micrograms of selenium is a good place to start, and between 4 and 8 grams of ovasitol daily can also be helpful both for thyroid autoimmunity and blood sugar stability. And last but not least, vitamin D. This is one of the most overlooked fertility labs. Vitamin D is involved in hormone regulation, egg quality, and immune function, and it's particularly important for women with endometriosis. Vitamin D deficiency is also tied to the growth of endometriomas, with the largest endometriomas growing in women with the lowest levels of vitamin D. Since endometriomas can be quite destructive to ovarian function and egg quality, vitamin D does play an important role in egg quality and fertility. In terms of when to test, anytime, aim for levels over 50 nanograms per milliliter or over 125 nanomoles per liter for optimal fertility outcomes. I also want to give a special shout out to iron because it's an important mineral for supporting egg quality, thyroid function, and oxygenation throughout the body. I would also shout out DHA sulfate and testosterone labs, as these are 2 important androgens for supporting egg quality and follicular genesis. More to come on these hormones in future videos. So to recap, progesterone, which should be tested around 7 days after ovulation. AMH, which should be tested anytime. FSH, LH, and estradiol should be tested on cycle day 2 or 3. A thyroid panel, which should be tested on any day, but be mindful of supplementation. And vitamin D, which again could be tested anytime, are important first labs to consider on your fertility journey. These tests can offer powerful insights into your hormonal health, egg quality, and immune environment, and help you take more targeted steps in your fertility journey. If you're in certain parts of Canada, you can request your own blood work at bloodtestcanada.com. And in the USA, but outside of New Jersey, New York, and Rhode Island, you can request labs through requestatest.com or via a healthcare provider with a Rupa Health account. And as always, if you found this video helpful, please give it a like, subscribe if you haven't already, and check out the free endometriosis gut guide linked below. So let me know in the comments below, which of these labs have you had tested and what are you most curious about in terms of labs for your fertility journey? I'll see you in the next video.